Hi, fellow cardiac warriors. I want to congratulate you. You are on the second module. Thank you for being here. Thank you for being on this journey and giving yourself the best possible chance to get through cardiac surgery. Today is about your beliefs and your belief system, and I really believe if you can check and assess your belief system and probably adapt it a bit and tweak it a bit and just make it bring it more on the level of awareness and consciousness. This can really add a lot of value to your life, and you can even help other people with their belief systems about your cardiac challenge and also about their life challenges. So very interesting is that William Shakespeare, he said that nothing is either good or bad, but thinking makes it so. Nothing is either good or bad, but thinking makes it so. So what you think about life determines whether it's labeled as good or bad. A holiday can be a bad thing to some people because now I cannot work and I cannot earn money, so this is a bad thing. And it can be the best thing to other people because now I can rest and I can see the world and I can be with my family or whatever. So no matter what happens to you in life, you can either label it as good or bad, and it will be so for you. Just to further this point a little bit, if I draw a 6 between me and you, from my perspective, I draw a 6, what will you see? You can say, yes, I will see a 9, and you will most probably be right. But we can then go in an argument. I can say, no, this is definitely a 6. I drew a 6, and this is a 6. And you can say, listen, Johan, I definitely see a 9. This is definitely a 9. You can see where the line in the wrist and where the bigger part of the figure is. This is definitely a 9. And we can go and argue to and fro and back and forth, and we will probably arrive at nothing because we see it from different perspectives. Somebody else said, that life is not as you see it. You see life as you are, not as it really is. And that just points in the direction again that we see life from our internal environment, not from as the external environment really is. So the same with this disease. You don't see it as it is. You see it as you are. Your internal environment, whether healthy, whether truthful, whether informed or not informed, it will determine how you view, what you believe about this future surgery that you will go through. So this is very important, that we give ourselves this opportunity to rethink where we are. When I heard that I was diagnosed as with a heart disease and I have to go through this heart surgery, I immediately started thinking that this might be the end. This is the beginning of the end. And the reason for that is that my grandfather died of heart disease, and many of his brothers died because of it. And my dad was diagnosed with heart disease, and it had a huge limiting effect on his life, also an emotional crippling effect almost on his life. So my experience of heart disease is actually really a bad one, and that formed my belief system around heart disease. Now, I don't know what your belief system is, but I want to challenge you to give yourself this opportunity today to rethink where you are with your belief system. So last time, we realized that we can be proactive people. We don't have to be reactive people. In other words, that the stimulus is there and your response just flows automatically out of your stimulus. No, we have, between the stimulus and the response, we have an opportunity to make some choices. We can choose how we will respond. The same is also applicable to a belief system. You have a certain stimulus, you can just jump to your normal belief system, or you can say, listen, I want to choose what I believe about this situation. That will determine my belief system and how I will respond to this whole event. So we are proactive. We can make some choices. We also last time discussed how you can go through the change process. And you know that your mind and your heart and your will definitely determines how you go through a process like this. But there is a point. There's the eye of the needle where you have to go through. We have to let go of some of your assumptions, some of your old thinking, in order to let come new thinking and new processes. There was an old normal, there will be a new normal. And you have to let go some of your old normal thinking and habits and activities and let come a new normal, which can be even better, more meaningful, healthier, happier, if you are willing really to go through the eye of the needle. If you keep on holding on to the old normal as if that's the only way that life can be meaningful and it can be happy, it will be really difficult for you to go through this whole thing. But if you are willing to embrace a new future where life can be different and even better, it can be so for you. We also discussed the positive intent exercise. You can actually decide, what this thing will be all about. You can label this as my new opportunity on life. You can decide what you want the outcomes to be. You can also think about the kind of emotions that you would like to experience from now until your surgery and directly after your surgery. It's also important to be quite open about and intentional about your mindset and your attitude that you want to have in this situation. And then you can just think and determine your value system. What is the driving value system that will determine your attitudes, that will determine your outcomes, your activities, your actions, and your emotions, that will determine the overall outcome of this whole process. So just to be intentional about it, to bring it from a level of unconsciousness to consciousness, of awareness, and to be intentional about this will be hugely helpful. All of that is also applicable in this process that we are going to go through right now. So we're talking today about your belief system, to check and reset your belief system. A belief system is very much like a table with a tabletop and certain legs. We have a belief, that's at the tabletop, and then you have the reinforcements or the evidence that actually leads towards this belief. Often we will have a certain belief about ourselves. For instance, you can believe that I'm very smart, and then you have certain reinforcements, certain reasons for why you think that you are so smart. Or you can believe that you are not a good athlete, and then you have certain reinforcements, certain experiences that would lead to that. The irony is that whatever your belief is, your belief system will always act as a filter that will filter out anything that's not in alignment with your belief, and you will only attract those things that are in alignment of your belief. So you will just gather more and more evidence to prove to yourself that your belief is actually true. But what can be really very helpful in this situation is to ask yourselves, is this belief that I have, is this really, really true? Is there perhaps a possibility that this belief might not be 100% true? Or there's a better way to put it, a better way to believe in this situation, a better belief about this coming operation in this case now. So I have set out some old beliefs, new beliefs, just to help us to rethink this, because the old belief and new belief also will lead to old paths and new paths, old ways and new ways. It will definitely have an impact on your behavior. So just be patient with me and go through some of these beliefs. Some of them, most of them overlap, but it's just different ways to say the same thing. But it's also just helpful. And I actually intentionally use different statements that actually state the same thing, so that we can actually reinforce an old belief system with a better belief system. Because the beliefs that I point out here are very, very common. There are, of course, many other beliefs about your physical conditions, and I'm not going into that. That's also very helpful to check your information, whether that is right. Some people believe, when I go through this operation, I will never have a normal life, a sport life again, or I will never have a normal sex life again. Most of those things are totally untrue and ungrounded and uninformed. But let me talk about some of the emotional beliefs that we often have. One belief is that I'm a patient, and therefore I'm a suffering person. I'm a victim. That's what a patient means. A patient is somebody who has no say, and you just have to undergo everything that's now happening to you. Poor you, and then you have pity on yourself. Or you can say, no, come, I'm a warrior. I'm a conqueror. I'm on my way to recovery, to health, to life, to a better life. When I was diagnosed, I made a very intentional decision, and I also told the medical staff that I don't see myself as a patient. They shouldn't call me a patient. I am a recovering sportsman. It just helped me to keep my identity, because your identity, to a large extent, determines your destiny. Your identity determines your destiny. Your I am statements determine I become realities. Your I am statements determine your I become statements. So what you say you are, you will become more and more like that. Another statement that people make, a belief that people might have, is that they might think that by focusing on my problems and challenges, I can pity myself. And therefore, because I can pity myself, I feel better for a while. We all feel kind of good when somebody takes pity on us. But that only lasts a very short while, and it leads to depression and a lot of negative emotions and sadness. But if you could rather tell yourself, I choose to focus on recovery. And by focusing on recovery, I am going to stay positive and hopeful and motivated. That's far stronger, and the emotions are far more energetic and helpful. Another one that you can also allow yourself to go into is to say, my life is over. I've got this heart disease, and now my life is over. A very central organ in my body is affected, and now my life is over. It's far better to say, this is a new chance on life, and I'm grateful for it. The fact is that most heart patients, after their heart operation, recover, and they live a normal lifespan. And they don't die of heart disease. Most of us that are listening to this talk that I have will not die because of heart disease. You will die of other stuff. And we can pity ourselves now and think ourselves into a deep pit, or we can say, no, man, I've got a new chance on life, and like many, many others before me, I will live a full life after my heart surgery, and I'm so grateful that I have this opportunity. Another way to talk about it is to say, I'm a victim of genetics, of cholesterol, of circumstances. I was born in a certain culture where we eat in a certain way, or in a certain family, or I was just born in a family with an aptitude for cholesterol. Or you can say, no, I can perhaps not choose what happens to me, where I come from and which family I was born into, but I can definitely choose how I will respond to it. I am a warrior. I am a conqueror, and I have choices. I can overcome this. I am going to ask myself new questions about my lifestyle, about my diet, about my attitude to life, and I will do some new things to my life that will make my life even better than ever before. You can also go into the belief of why me? Why is this happening to me? Why me? I've done everything right, and now this is happening to me. That was definitely a question that came to me. A lot of people ask me, Johan, why you? I mean, you were cycling. We never see you eating, bad stuff. And why is this happening to you? But, a lot of people do suffer because of cardiac disease, and many of them lived really very healthy lives, and you might be one of them. It's not very helpful to ask the question, why me? It's far better to ask the question, what now? What can I do about this? It's far more empowering, and it's far more future focused to ask, what now? Yes, it is what it is. Let me ask the what now question, and let me choose a better future. Another way to talk about this is just to say, I can die from this. But the fact is, the statistics are that 98% of all cardiac surgeries go well. The success rate of cardiac surgeries is very high. So your chances to come through this on the other side as a healthy, better, a healthier person is quite great. So it's just important to overrule that very negative belief that I can die from this. You will most probably not die from heart disease. You will most probably die from something totally different. You can also have this belief that this is the scariest thing I've ever had to go through. I mean, you're going to go through a really very invasive surgery. They will cut open your sternum. Your heart will be stopped. You will be on a ventilator. Your heart will be stopped for some hours. This is for most cardiac surgeries. Maybe yours is a bit different, but it is quite invasive. But the fact is, you are placing your life in the hands of very competent and very professional people who have had a lot of success so far by doing this. And they have probably done it many, many times before you. So, I mean, putting our lives in the hands of a pilot when you board an airplane, or putting your life in the hands of a ship crew is probably far more risky than putting your life in the hands of people who are doing an operation in very controlled conditions. You can also say this is a dark time. I choose to say, yes, this is a serious procedure, but this is not a dark time. I'm given a new chance on life, and I intend to make full use of it, to make the best use of this new chance on life. Can you see the difference? The one is looking at the dark side, the other one is looking at the light side, and you can just choose to believe what's going with the light side. You can also say, I just want to get my old normal back. A lot of people just want to go back to the old normal, to live their lives and to eat what they ate and to do what they've done in the old normal. But it's far better to say, I intend to create a new normal where life can be even better, healthier, more meaningful and happier than before. I believe it's possible. And it's all in my hands. I have control over this destiny. I'm going to make my life better. I'm going to make some good choices that will enrich my life and make my life happier and healthier and better. So you can see on the one side, we have an old belief system, which is very much problem focused. So you see this as a problem to overcome. Or you can have a solution focused mindset. I'm looking forward to a new life with new health, which I intend to use fully and with appreciation. It's a new life with new possibilities and opportunities. So the one is quite negative and not very helpful. The other one is very much empowering. And so I would like to encourage you to go and just take a piece of paper, draw a line in the middle. On the one side, write down all your old beliefs. On the right-hand side, just write down a new way of thinking and believing, which is far more empowering, taking you out of the darkness into light. So the question is now, why don't we really feel that something is true when we know it's true? Sometimes we know that this old way of eating isn't helping, and this new way of eating will be far more helpful. But it doesn't feel true. It doesn't feel appealing. It doesn't feel like we want to do it. Why is it so? It is so because we have an old brain, a limbic brain, and we've got a new cortex. Our brain secretes certain hormones like adrenaline and cortisol in our bodies. And our old brains is set up for survival. It wants to move away from pain, move away from displeasure. It wants to avoid anything that's uncomfortable, and it's set up for that. That's why the old brain is set up for fight or flight or flee or hide. It wants to protect you against anything that can hurt you. But there's a different way of living, and that's to set yourself up for growth and for pleasure and for reward. But it's far more difficult for the brain to strive for something better if there's something that can be dangerous. So in a dangerous situation, we tend to apply all the old survival tactics and techniques and strategies to survive through a process. And when you are where you are right now, you are facing a huge procedure. You want to go in survival mode. So to reset your belief system to help you to move towards a more thriving mode and a victory mode is quite difficult for your brain to do. So I want to suggest a process that can really help you to reset your inner reality, reset I would even like to say your nerve system, your neural system, so that your brain and your internal system will be differently wired and will fire different. So its wiring and firing will be different after that process. And it's a quite a simple process, but it's quite a deep process. And I want you just to be patient with me and just go with me through this process. I call this process the Arab method. And it's based on neuroscience. You can call it many other things. You can make it 7 steps or 8 steps or 3 steps or whatever steps you want to do. This is just a way to describe what I have learned from neuroscience to reset your internal reality. So the first thing that you have to do before you can grow and change as an adult is to be aware of what reality is. Just to acknowledge this is what it is. So in our case now, we have to be aware that you are going through a huge process. It's going to be invasive. It's going to require some flexibility and adaptability from your side. And it's something that will be painful sometimes, but there will be help just to acknowledge and to be aware of what the realities are and not to run away from that. That's a very important thing. And just to be aware of your emotions, and then to acknowledge those emotions, because we can suppress our depression or our sadness or our feeling of loss or our anxiety, our fear. We can suppress those things, or we can just say, let me just acknowledge what is going on with me, because then I can do something about it. What you don't acknowledge, what you are not aware of, you can actually not manage. We can barely manage it, but actually we cannot manage what we are not aware of. So the second step is to reflect on that, to try to understand, where do these emotions come from? What are my beliefs that actually are leading to these emotions? So I want you just to close your eyes for a while, and I want to take you just through these 2 steps so you can just feel something with this, because this is an internal process. So just close your eyes, and I want you just to sit back in your chair and just breathe and focus on your breathing. I want you now to become aware of some of your emotions in your body. Maybe you feel it in your shoulders or stomach, or even in your legs or toes, or in your head. Just acknowledge those emotions that you feel, those sensations that you feel, and ask yourself, what emotions are these? And now the second step is to ask yourself, where do they come from? What beliefs are there underlying these emotions? Because my perceptions and my beliefs lead to emotions. So you have certain beliefs, how this operation will be, what is going to happen. And those beliefs are leading to your emotions. Just become aware of that and reflect on that and see it for what it is. Okay, you can open your eyes again. Now I want you to do the next 3 steps. The third step is to replace those beliefs with new beliefs. Now we've done the exercises, writing down the old beliefs on the one side and the new beliefs on the other side. But now I want you just to think about what you just reflected on and now replace it, and maybe go and write it down. All those new beliefs that you would like to have. And it doesn't have to be, every old belief or every new belief. It can be a bunch of new beliefs, a new way of looking at this operation. And I want you just to make a choice that this is the way, these new beliefs, this is the way that you would like to think about your operation. You take this on as your new way of operating, of thinking, of believing. So that's your replacing step. And now the I, the fourth step, stands for internalize. And again, I want you to sit back and I want you just to think about those beliefs and think about all the new emotions that you can invite into your heart. And in this case, I refer to your heart as this part here behind your chest. What emotions would you like to invite into your internal life? Happiness, yes. Peace, love, gratefulness, appreciation, empathy. Just invite all those good emotions into your heart and reaffirm the new beliefs that you chose for. And let it just come to you. Just feel it, embrace it, nurture it a bit, and be grateful that you can have these emotions right now. Gratefulness, happiness, peace, calmness, love, thankfulness, appreciation. Okay, you can open your eyes. So this is an internal life that you are starting to create. And you can do this exercise over and over. The Arab process you can do over and over for yourself. The last step, P, is practice. To practice this, to live from this internal life. You can choose either to live as you used to live, as you are prone to live, or to go into this new mindset with a new internal life. I'm prone to be quite upbeat and to be quite worked up, and to become quite worked up. I can stress quite easily. I come from a family like that. But I've chosen to go into this operation with calmness and positivity, and with an open mindset, appreciating the medical staff and complimenting them and thanking them as I go on. It made a huge difference to me and also to people around me. I created a different atmosphere around me. And you can too. I want to encourage you. Create the best possible environment in your home right now, at work if you're still going to work, in the hospital, in your hospital room when you are going to hospital. Just create an atmosphere that makes it wonderful for people to be with you and to work with you. And when you go through the operation, when you wake up in ICU, make it a pleasure for people to work with you. May you invite a new belief system, and with that, a new emotional environment, internal environment that you would radiate to other people, and make it a pleasure for people to help you and serve you so that you can get well as quick and easy as possible. All of the best. I see you in the next video, and I'm sure this will be quite a wonderful journey for you as well. We're going to look at some practicalities and how practically you can help yourself emotionally to cope with things and to prepare for the operation. But for now, please go and do the Arab process. And yes, one more thing. Would you please start writing down some of your thinking and your emotions in a journal? Journaling is so useful. If you can do that, it will really help you to be much more aware and to be able to manage those things that you are becoming aware of. All of the best. Blessings. See you in Module 3.